Yes. Thank you everyone for having me again, and happy Women's Day to all of y'all. I think this is at least one of the ways where you guys can get to know out of your busy schedule that what y'all are missing out on your, probable health problems or not. That most of us women usually just forget, because once you finish your work, you go home, you have other problems of your house, and obviously you ignore yourself until it's like either too late or it's somewhere in the middle. So these kind of activities, which is done by your companies to actually give you a foresight into your health, is wonderful. So we'll start off with the presentation. This is basically understanding yourselves from your 20s, 30s, 40s, and beyond. So there's a poll that's going to happen, and I would like you to take the poll before we start off. So this basically asks you, when was your last annual checkup, whether you've had it or not, in the month, year, or never done it at all. And how often do you consult your primary physician and a gynecologist? And your other question is, do you even know anything about your family history in detail?
I would request everyone to answer all these three polls so we get some idea before we get started.
I hope you'll have done at least two of the three.
Yes, we stopped the poll. This is the results.
Fine. So if you see, actually never done any checkup is pretty scary, right? And how often do you actually visit your consult? Again, haven't done it regularly. I mean, y'all are all working ladies. It doesn't mean that you don't take care of yourselves. And at least family history wise, 62% of y'all know exactly what's happening. So y'all know that there is an illness in the family. And the only thing is that this 62%, I hope y'all don't belong to the category where you've not done your regular checkups and never gone to a doctor. So moving on to your next slide, at least now I hope you'll get some kind of, idea as to why you should get your test done. See, everyone has a family history, especially in India. All of us have a history of having diabetes, hypertension, and thyroid problems. So when you know that you have a probable history, even if it's not your direct, your mother or father, even if it's your grandparents, you can decrease your risk of chronic and preventable diseases by screening yourselves. Take preventive health measures to reduce your unplanned, any kind of unforeseen medical expense. You can go to the next slide. Yeah. So 70% of serious women healthcare issues are preventable. And like I said, thyroid issues, PCOS, which is very, very common these days, and it's mostly because of our lifestyle. Basically, you all are working women. You'll have your own time frames, and your diet may be a little messed up because of that. You might not get enough time to actually exercise. And these are the main root why these problems happen, including thyroid problems, your PCOS, endometriosis, other cancers like cervical cancer, breast cancer, and uterine cancer. All these can be screened by you at least getting annually checked. So what's less talked, and at least of the last few years, it has been a little more given a little more importance, is one is reproductive health, sexual health, and chronic disorders. Now, reproductive health, at least people are aware that if you are not ready to become parents at the age of 35 or so, you have an option of egg freezing. So at least when you know this, that there is an option, you don't have to worry about the future, and at least freeze your eggs at the right time so that at a later point you can make use of them and your success rates in IVF is much better. Sexual health, at least, now I'm happy that people are actually coming out and talking about it so that women actually know exactly what they like first rather than what their partner likes. So get to know your own sexual health first. Chronic disorders can be pertaining to any illness that you have in your life. That is from your childhood, it could be asthma, it could be thyroid problems, which could lead to other metabolic disorders. So screening yourselves can get you an opportunity to discuss about these problems also. So your reproductive health is, firstly, everyone should know exactly what kind of menstrual cycle they have, whether it's a regular cycle, irregular cycle, how is your flow, do you have clotting associated with it, is it very heavy, is it very light, do you have spotting in between? So all these things actually give us an idea about your uterine health. Now, what you should do when these things happen is definitely visit your gynecologist, explain all your history, symptoms, and any medications that you are taking. Because some people who are taking antidepressant medications can have irregular cycles. People who are on some kind of steroids can have irregular cycles. So these things are very important when you're giving your history. And you have to get, it's not like just meet your doctor and then, okay, she said this and I'm going to leave it. You have to follow up, get your adequate, the actual tests that are required. Those tests are more than enough. You don't have to get your whole health checkup done. So I've seen most of the corporate patients who come and they ask me, okay, what test do you want? And if I give them just 5 tests, they do the complete test, even though they've done their annual hardly 3-4 months. It's not required. Only the test that you need, and especially for period related problems, it's only to do with your thyroid, your prolactin, and your sugars. These are the more than enough. Apart from that, when you get your doctor's prescription, please complete the course of treatment, because people like antibiotics take it for like till they're feeling better and then suddenly stop it. So when you do this, again, you're not giving your body the right chance to heal and perform better. So reproductive health, menopause is something which is a little scarier these days, because I'm seeing a lot of patients with, premature menopause. So as young as even 35 years old. So if you have any kind of irregular cycles which pertain to very less flow, low libido, mood swings, hot flashes in the evening especially, vaginal dryness, no interest in sex, these kind of things you should get checked by your doctor, and few blood tests and a scan will definitely tell us whether you are in that category. Because if you have not yet planned your family, this is the right time to at least get whatever eggs we have so that we can go forward. So your health risks are like estrogen levels decrease, again, heart problems, osteoporosis, urinary incontinence, urinary tract infections. All this happens because of the lack of estrogen and progesterone, which makes dryness increase, and that's why all these things happen. Now, cancers, depending on the percentage of cancers that you are probably at risk for, cervical cancer is 6 to 29%. The one good thing about this is that you can actually screen this. And for all of you who have not taken the cervical cancer vaccination, please do take it. You can take it up to the year of 45 also. People who are not exposed to even one sexual encounter is the best to take, because this gives 100% coverage for HPV infections, which cause cervical cancer. So you can basically get a pelvic examination, a pap smear, and only if there's any kind of abnormality, we go for a biopsy. Get your HPV vaccine at the earliest, and that's always good. Breast cancer, in another way, is that you need to at least check your breasts every month. Just immediately after your period would be the right time to do it, because before your period, it might already be engorged and you might have pain. Once you start examining it, best time to examine it is under the shower when you're all soaped up, because it's much more smoother and easier to identify any lump. Check for the size, check for the color of the breast on either side, any kind of visible veins, any kind of pulsations that you can see, any discharge from the nipple. And when you're palpating, you have to palpate from your axilla, from the armpit, in a clockwise manner throughout the breast. So at any point of time, if you feel any kind of abnormality, get it checked with a doctor. And nowadays we do an ultrasound breast just in case if we have a doubt, and that is more than enough to rule out any problem. If we actually have a suspicion, we go in for a mammogram or an MRI. Again, self-examination is the best thing to do, and get it checked. If biopsy is required, we do it. Genetic testing is for those who have immediate family members like your mother or your aunt who have had breast cancer. You all can go and get these tests done, like BRCA1 and 2, and these we can predict whether you have a chance of increased risk for breast cancer. And if you do, there are methods where we can reduce it or prevent it also. Now, ovarian cancer is from 1.7 to 15.2%. Now, this usually when people have over their uterus in them. So sometimes when you get your uterus removed, people just forget about their ovaries, but that's not what's supposed to be done. You need a yearly scan to assess your ovaries. Because as long as you have the uterus, if there is a growth in the ovary, your uterine bleeding will definitely show us what's happening. So regular screening is the only way. So once a year scan will not do any harm to anyone. Uterine cancer again is only 4.3%, but again because of our lifestyle changes, our eating habits, the increased prevalence of PCOD, these kind of things have an unopposed estrogen on the inner lining of the uterus. That is what causes this change and causes the change in the cells, which happens over a period of years. And then at one point, when you have this very heavy bout of bleeding or a very thickened lining inside, and we do a DNC, and that shows us that you may be at risk for cancer, that is when we go to the next step. But again, regular screening is a thing that we can do to prevent these measures, prevent these problems. Now, knowing the risk factors basically for any kind of cancer, especially breast cancer, is your family history. Like I said, your mother or sister, personal history of breast cancer, recurrent breast cancer can happen. Screening is done at almost every age. You should tell your children, even your young girls from an early age, how to examine themselves. And a mammogram is the most common type, but nowadays even MRI is done because it's a much more easier way to do any kind of lesion. So self-examinations can be done by, like I said, every woman should do it. And clinical breast cancer screening should be a part of your annual physical checkup after you hit the age of 40. Because all these are estrogen-based tumors. So as you're increasing in age, that's when your cells change. So sexual health, there are 4 P's of STI prevention. That is prevent your sexually transmitted diseases, preventing unwanted pregnancy, good pelvic health, and pleasure. Now, the first one, most of us are very careful about. So yes, the incidence of STI in India is a little bit on the lower side. Preventing unwanted pregnancies, condoms are very effective in that, but again, it has a high failure rate. It can go up to even 2 to 10%. Good pelvic health is something which is over exaggerated sometimes. So nowadays you get a lot of new products in the market. There are yoni pearls and there are vaginal tablets just to make it to smell better, or they claim that it's good for the vaginal health, but you already have good bacteria in the vagina called Dodeline's bacteria, and that is more than enough to keep your vagina healthy. So as long as you maintain your general cleanliness and make sure that you don't have any abnormal discharge or heavy discharge or foul smelling discharge associated with itching or pain, I think you're good to go. And pleasure is something, like I said, you should first and foremost know what you like so that you know that what your partner could offer, give you. Your common STIs are chlamydia, herpes, gonorrhea, HPV, syphilis, and hepatitis B. So, in case if you even have a doubt or whether your partner has any of these symptoms where you feel that there could be an STI, you should get yourself checked. And if you are someone who has multiple partners, or you are in an open marriage or so, you should get yourself checked. If you have been exposed to infection, get checked immediately. There are certain infections that you can't diagnose, like herpes. You cannot diagnose when there's an active lesion, but we can give you medication for the same, and later on we'll tell you how to prevent it. Other infections need oral as well as topical treatment. It's not that you take only oral tablets and expect it to clear out. So in that way, take care of your sexual health. So preventing unwanted pregnancies, there are different methods. But like I said, barrier methods, 98% is what they claim, but you can have a 2 to 10% failure rate. This is one of the best things only because it prevents your sexually transmitted diseases as well as pregnancy. No other contraception does that. So even in barrier methods, you have a male condom and a female condom. If you ask me, a female condom is much more effective than a male condom. Your hormonal methods, there are pills, there are patches, there's vaginal rings and implanon. So all these things are actually progesterone containing implants that actually will help you thin out the uterine lining and prevent a pregnancy. So the rate of your efficacy is actually much more better. It goes up to even 99%. And intrauterine devices like copper teas, or even nowadays we have something known as hormonal IUDs, which is known as Mirena. So this reduces your risk of any kind of abnormal bleeding and pregnancy. So it's completely safe to use. It's not like before where many people have this misconception that it can lead to weight gain or infection, or what if it gets dislodged, or it might cause me to lose a lot of weight. Absolutely no. It's completely safe and everyone should know about it. So maintaining pelvic health, this along with what I spoke about your vaginal health, pelvic health is basically it's like a sling. It contains your bladder, your vagina with your uterus, and the rectum. So in your 20s, it's like very, very strong because you're still young and all the muscles are very taut there. So there's no problem until unless some people have chronic cough, people with asthma, constipation problems over a long period of time also can worsen the pelvic health. So doing heavy lifting exercises without a proper breathing technique also can lead to this. So you have to know what a Kegel exercise is and start it off from a very young age to make sure that you don't have problems later on. Now after 30s, like whenever you have your child, your pelvic floor is destroyed a little bit. So obviously you'll have to get back the tone of it. So you have to do your Kegels on a daily basis, like how you're doing your normal activities, like bathing, the same thing. Maintain a time for Kegels. Do at least 10 sets of 10 episodes, at least in a day. So that, and you can do it at any time when you're watching TV, when you're, just sitting around the house or reading a book, anytime. But you have to get it done. And beyond your 40s, again, menopause is a period where all your hormones basically fall, and because of which all the muscles over there relax and they become a little more loose. That's why we see cases of prolapse after the age of, probably 50 or 60. So continue doing the Kegels exercise. It will help you in your urinary incontinence also. So chronic health, like I said, all kinds of thyroid problems, metabolic problems, PCOD. So if you have any of these symptoms given here, like abnormal weight gain, irregular periods, hormonal acne. So when I talk about irregular periods, doesn't mean that you miss your date. It should be somewhere between 21 days to 35 days. If you have a period in this range, there is absolutely no problem. If you have hair loss, that is especially male type of balding. If you have facial hair, which is thick, usually around the chin, on the upper lips, or even on your abdomen, on your chest, on the near the breasts. So all these things you should know about. Mood swings, pre-diabetic symptoms like excessive thirst, excessive urination. If you have any blackening at the neck or in any kind of the groin part, if you have any other problems like which relate to insulin resistance. So these are the things that cause insulin resistance due to PCOD, and you can see it in these forms of your symptoms. So fatty and liver enzymes, excess fatigue, chronic stress, all these are other symptoms that you should be screened for. So why should you care? Now, one misconception that everybody have is that, okay, if you have PCOD, you surely won't get pregnant, or even if you get pregnant, you will have a miscarriage. Now, if your symptoms are under control, there absolutely is no major risk for this to happen. So you need to make sure that your cycles come regularly and make sure that you're having a proper lifestyle modification so that it's not only for to get pregnant, it's also throughout your life. So these things can also, prevent diabetes, cardiovascular conditions, endometrial cancers. All these happen because of estrogen. So get your lifestyle proper, your diet proper, exercise at least 5 days in a week, and you should be fine. So test for screening PCOD is again, it comes under, if you have two of the three criteria, that is when we call it as PCO. That is one, if your periods are irregular. Another one, if you have all these symptoms. And the third one is when your ultrasound shows these multiple cysts in the ovary. So basically the cysts are not like full or big water containing fluid. Those are your eggs itself, which are surrounded by male rich hormonal fluid. And this causes all these symptoms that I'm talking to you about. So if you reduce the fat content in your body, these symptoms also will come down. So thyroid disorders, around 10 to 20% of women in India actually suffer from this. So if you have any of these symptoms like irregular cycles, fatigue, weight gain, dry skin, puffy face, intolerance to heat or cold, higher cholesterol levels, pain and swelling in the joints, thinning of the hair, and stubborn weight gain or weight loss which you're not able to get through. And this causes, again, it's thyroid is a gland that is situated in the neck. And this gland produces this hormone called as thyroxine, which is very important for every part of our body, from our eyes, brain, heart, skin, everything. So if this is not in that range, you will have a lot of symptoms that you will be able to identify as soon as it hits more than 6 in your TSH value. So if you take care of it and at least start your medication and take it on time and not eat any food at least for 1 hour after that, you should be taking it on an empty stomach. You will be in a much better position and you will be able to even take care of your obesity, joint pain, infertility, and heart problems. So the only thing to do is one, your thyroid test. And if your thyroid test shows a hyper or hypothyroidism, depending on whether we can palpate or if it is an enlarged gland, you might be asked to do an ultrasound. Otherwise, thyroxine medication is more than enough. So endometriosis is again, it's a what you said, developing country kind of disorder where they say that it's the disorder of the rich because depending on the diet that you're having, increased in fatty acids, increased in cholesterols, increased in trans fats, increased in any kind of meats that you're having. So all these actually attribute to the cause, to one of the reasons that cause endometriosis, apart from that of being genetic. So if you have very painful periods, now pain in the sense you are not able to do any other work other than just lying down in that day, and you have severe abdominal cramps associated with it's extending to your legs, to your back. You feel like vomiting, you have headaches. So these are the things that show maybe that you have endometriosis. Apart from this, any kind of physical pressure, like when you're passing motion or you're urinating, also if you have pain, sex becomes horror because it's so painful. And excessive bleeding, fatigue, bloating, nausea, all these are also symptoms of endometriosis. So why should you care? Endometriosis is basically what happens is that the lining that is inside the uterus, most of us, it comes out through the vagina. For everyone, almost everyone, there is around 5% of blood that can actually go backwards through the tube and fall onto the abdomen. So when that happens, it is, for some people, it acts like glue and everything in the abdomen gets stuck. That is when you have a chance of actually forming an ovarian cyst also. That is known as a chocolate cyst. This can cause infertility later on. So if you do have any kind of doubt whether you have endometriosis, it's always better to go get checked and get the right treatment so that you don't have to actually face these problems early on. So again, early onset of menopause is because the amount of ovarian quality is reduced and you might go into premature menopause. Chronic pain is something that is a lifelong problem. There are only two actual treatments, natural treatments for endometriosis. One is pregnancy and one is menopause. So get screened for this and you should be fine. So things that you can do today is get your regular screenings and preventive tests, keep a track of family medical history, and build healthy habits and make lifestyle modifications, which will make sure that you don't progress in any kind of disease, at least for a long time. So the 4 preventive health checkups that you can have, like I discussed before, annual blood tests, your ultrasound annually, pelvic examinations can be done once a year, depending on whether you need a pap smear done once in 3 years. If it comes normal, then once in 5 years, and then once in every 5 years after the age of 40. But these are the things which will at least make sure that your general health as a woman is fine. Thank you so much for your patient listening, and I hope I can clear any doubts that you all have.
Thank you, everyone. We do have some questions. I'm going to stop sharing. We've been receiving some questions as we were in the chat. So I'll just take it up to you. You can also drop your questions. We'll take to the doctor. Cool. Yes. So how does one know their fertility rate and what age would be the best to freeze eggs?
Sorry?
What age would be the best to freeze eggs and how does one know their fertility rate?
Yeah, so basically we have a test known as AMH. Okay, even on a normal ultrasound scan, we can actually find out how much ovarian reserve you have by the number of follicles that are present. So sometimes when we get patients, even as young as 28, and we do a scan and we see only 2 or 3 follicles, we have a doubt that maybe she has a low reserve, and we do a test known as AMH. Now, the normal value of AMH can be anywhere between 2 to 5. So in people with PCOD, because of the multiple number of follicles, it can go even up to 20, because that shows that even though you have eggs, it doesn't mean that it's of good quality. So for a healthy pregnancy to happen, it should be both a healthy sperm as well as a healthy egg. So egg freezing can be done at any point of time. So it depends on what your goal is and by what age you want to get pregnant. So if you have an actual problem at the age of 25 also, yes, go ahead at 25, freeze your eggs and later get pregnant. But if you are someone who was at 38, I would suggest that you would rather go for a pregnancy than freezing your eggs and trying on later on, because after the age of 40, your chances of developing problems in pregnancy also double.
Are the chances high for a person getting breast cancer when in a family there is a case?
Yes, yes. So if you know about, if you must have heard about, Angelina Jolie also getting a mastectomy done only because her genetic test came positive. So it is something that she did to even try to, completely eradicate the chance of her getting cancer. And now she would not get. So she got her ovaries removed, uterus removed, and her breast removed. So that cancels out any estrogen reliant organ. And yeah, that's about it.
Can uterine fibroids be dangerous?
See, it depends on the size of the fibroid, the location of the fibroid, and if it's actually going to give you any problem or no. I have a 81-year-old patient of mine who comes in with a huge fibroid, which is almost like a 7th-month pregnancy, but she's very happy with it. She's like, I want to take it with me to my tomb. But at the same time, you can have a small 2 centimeter fibroid, which is lining in the inner lining of your uterus, which can cause a heavy bleeding, and that needs surgery. So, depending on your size and the site of the fibroid, we decide as to how you should go. But the chance of which a fibroid can change into cancer is very, very less.
If you can share more details on HPV vaccine, like when to take it, what is the cost, is there any examination or test to be taken before the test, and any precautions as well?
Yeah, so before you take it, yeah, getting a pap smear done would be good. And when you need to take it is, like I said, usually from the age of 9 to 11, all girl kids need to get this done. And for them, it's only a 2 dose. So only a 2 dose vaccine is enough. After the age of 11 is where everyone has to take a 3 dose vaccine. So you take it within a period of 6 months, a 0 month, a 2 month, and the 4th month. So by then you'll finish the course. And each injection, now we have in India only something known as Gardasil, which is a quadrivalent vaccine. And that basically, I think they're charging around 3,800 per vaccine. So you will need to make sure that you get this done. Probably after your period would be a good time to take it. Apart from that, there's nothing else that could cause, it doesn't cause fever, it doesn't cause any kind of major reactions. And it's a pretty safe vaccine to take. And when you can actually prevent a cancer, why not?
Can you please tell about prolactin, CLIA?
See, prolactin is a hormone that actually is released by a small gland in your brain. Okay, so the pituitary gland, and that basically has a lot of impact on our. Usually, when the prolactin levels are high, you do get a certain amount of watery white discharge from your breast, like milk. So, in lactating women's prolactin levels are very high. So, in cases where there are small tumors in this gland, that is when you have these kind of symptoms. So if your prolactin levels are more than 100, 200, we would like to get an MRI of the brain to make sure there's nothing like that. And if there is, depend on whether medication is enough or you need surgery, we have to go through that.
Can you share your last screen, the 4 tests that are required? We can make a note of it in the meantime.
Sure, sure.
Thank you.
Is it visible right now?
Yes, yes.
No. I'll just continue while you take note of that.
How safe birth control pills are if taken for a long term. And I'm taking it as a treatment for period pain. See, birth
Yes.
control pills are fine for even up to 1 to 2 years. I would not suggest like there's any problem with taking it, because nowadays it's very low dose and very safe pills that are coming up. But it shouldn't be such that you are dependent on that and that your cycle will not sometimes what happens, there's something known as pill dependent amenorrhea, where because you're on the pill for more than 2 years, it takes time for your periods to come normally by itself. So I would suggest maximum 1 to 2 years. And then if you want to go for birth control, you can use other methods which are much more effective.
Before planning to conceive, any test should be taken?
Yes. Before even getting married, also sometimes some tests have to be done. Because even though whatever it is, there are certain conditions where certain people have a risk of increase in uh, problems like thalassemia, blood disorders, and these kind of things can be actually prevented in your baby. There's no point in getting married and then saying, oh, okay, this happened and that happened. Doesn't make sense. So there's something called premarital checkup that you need to get done. Same way, pre-conceptual checkups, you need to get your rubella checkup done, whether you actually have been vaccinated or you have an infection or have had the infection. If not, you need to take the rubella vaccine. Apart from that, you need to get a basic blood test of your hemoglobin, your sugars, your thyroid, and your ultrasound scan. So these are the basic tests. Apart from this, your serology, which is included of your hepatitis B, your HIV, HCV, and your VDRL. So these are the basic tests that we get done for everyone. And for the male, basically, it's only one test, which is a semen analysis.
Okay. What if it continues to white discharge? What if there is a continuous
White discharge, like I said, it's normal. Your vagina already has good bacteria fighting infection every day. Discharge comes out is a product of that. Only if there is thick discharge, curdy discharge, foul smelling discharge, itching associated, pain associated, you'll have to meet your doctor. But if there is excessive discharge, it's always better to check with your doctor. They might take a swab, they might check your cervix for any infection and give you a local treatment and give you something called as probiotics to help it reduce.
Is it good to do yoga during first trimester?
During the first trimester, the first 3 months of pregnancy, it's always better to go a little easy. So even if you're doing yoga, breathing exercises is good enough. Upper body stretches are fine. Don't do anything which strains your pelvis or lower body.
After pregnancy, I sometimes feel heaviness in my lower abdomen. Is it normal?
See, for everyone, basically depends on the time now as to how long you have been pregnant. Heaviness in lower abdomen comes with obviously the weight, and there is nothing. Your uterus is going to shrink back to normal. So it's not going to. The uterus is not going to cause you to feel heavy unless you have any problem in the uterus. But otherwise, like I said, doing a Kegel exercise every day will definitely make sure that this doesn't happen.
Actually, there's a question on what is Kegel exercise, how to do it.
See, basically, layman terms, what I'm talking is that when you're passing urine and you suddenly have to stop urinating, the muscles that you tighten down there. So you can try this even when you're urinating. When you're urinating, you suddenly try to stop. So the muscles that you have there, you tighten, right? The same thing you can do while lying down or anything. Clench your pull on or below and hold it for 10 seconds. So you can do it. Like when you're sitting now also, take a deep breath, hold the muscles for 10 seconds and then leave it. You can also do this with a ball. You can keep a small ball between your thighs and you can clench it with both your thighs and lift your pelvis up and take a deep breath. Those muscles are being pulled in and they're being contracted. So basically, like how people work out their abs, you're doing this for the pelvis, but it's much more effective because it's like I said, it's like a sling that is holding your bladder, your vagina, and your rectum together. So if you do it, it's good for your overall well-being for a long period of time.
Thank you. What is Ashogarish? Does it actually help?
That's an Ayurvedic question. But yeah, see, all these Ayurvedic medicines do help. I'm not like even Unani, homeopathy, as long as you don't have any major problem. Now, if somebody with uterine cancer goes and takes Ashokarishtam and says, okay, it's going to be fine, that's not going to work. So this will help in your minor problems, like if you don't have a proper flow, you want to try for 3 months. Try for a period of 3 months and so, and don't extend it over that. If it works for you, well and good.
Next two questions are regarding female condoms. Are they really available? Can you share more?
I didn't make that up. They are really available. You can Google it. You can find it on Amazon also, I guess. It's basically a condom which has two ends. So one end which covers the cervix, it's like two bangles. So one end which covers the cervix, you have to insert it inside and it gets fitted in one position and the other end outside. So this is actually one way where people feel they can wear it and go also. But yeah, it's much better than the male condom.
Yeah, next question also was share your thoughts on female condom. I think it's more safe than the male condom.
Yes.
Does the PCOD will reduce after delivery?
PCOD will increase after delivery because your stress levels increase, your sleep is deprived, you tend to put on more weight, you're eating much more. So I've seen a lot of patients actually have worsened symptoms of PCO after delivery. But like I said, just accept it as a lifestyle problem. Like that. Now, everyone whom I'm meeting, everybody's like, oh, I've got PCOD, I've got PCOD. We have PCOD, we just have to find out how to tackle it and go forward and make sure that, the symptoms are controlled. That's it, like diabetes. So if you don't take care of yourself, it's going to worsen. If you do take care of yourself, it's going to be controlled.
Is 3-day discharge normal?
Everyday discharge is normal. It's okay.
What is the validity of freezer egg?
Okay. Now, actually, forever, because as long as you're paying for it, because they keep the egg in the freezer as long as you pay for it. So I think they charge around 20 to 30,000 per year. And the year you don't decide and you feel like it's not required, then they will, all they have to do is just keep it outside. And these are all in small petri dishes and small test tubes. Once they keep it outside, even for like half an hour, it's gone. There's nothing to do about it.
I have a high number of prolactin. What should I do to reduce it? And I have PCOS.
That's what, high number. If it is less than 100, medication will work for you. If it is more than 100, you need to get evaluated by an endocrinologist. And usually people with PCO and hypothyroidism also have an increased prolactin. So yeah, you should correct that.
My ultrasound shows multiple follicle, but my hormone levels are good and periods are regular. Does it mean PCOD or not?
See, like I said, there are multiple variants of PCO now. It's just not one or two things. So if your ultrasound shows you may have a tendency to just be careful. No, they might write multicystic ovaries instead of polycystic ovaries. So it doesn't mean that you have PCO now, but you may have a chance. So just be careful.
What happens if prolactin increases to 35% for marriage?
35% or 35 value. I think 35 is the value you're talking about. Nothing happens. If it's 35, if it's very high, like I said, you need to rule out tumors in the brain. That is what is more important. So otherwise, it's a no. If it's 35, the value is 35, it's not a big deal. You can reduce it with medicine.
Will we get the recordings of this meeting? Yes, you can go to Nova Benefits YouTube channel and you can check the video out. We'll be uploading it in a few weeks, but still you can access the same content that we did last year. It's available on YouTube. You can refer to that as well. If my mother had difficulty in pregnancy, extremely high BP, premature birth, will I be also facing the similar problem during my pregnancy, and any cautionary steps?
Not exactly. See, extremely high BP, especially in pregnancy, is because of something to do with the vasculature in pregnancy. So when when a pregnancy is getting attached to the uterus, if the arteries don't go well and are not wide enough, that's when all these problems happen. So it doesn't mean that you actually would have this. Like I said, preconceptually, start your folic acid, make sure that your lifestyle is good, eat healthy, and try naturally for a period of 1 year. And if it happens, well and good, and continue the same diet. It's not something that happens with heredity.
We'll take last 2-3 questions. What would be the reason if periods is getting delayed 1 to 2 weeks, and is there a remedy to get it cycle naturally?
1 or 2, see, like I said, even up to 35 days is okay. If you get your cycle even in 35 days, is fine. Only beyond like 35 to 40 days is when we consider it's a delayed period. So best way to reduce, to get this to your normal range, is to lose your body fat. So if you start working out, at least go for a 30-minute walk. You will see your results in your period cycle becoming more regular.
Just to
So your
add to it,
diet and
wanted to confirm that if it is on time every time, but the flow is only for 2 days, so that is fine, or that
but
is
in 2 days, how many pads do you change?
4 to 5.
That should be fine. That's fine.
Okay.
Suppose in 2 days you change only one pad a day, that's not normal.
No.
Yeah, so that's
That
okay.
those 2 days are perfect, on time every time. Just that 2 days is the duration instead
Yeah,
of
it
regular.
should be 2 days. It should not become less than 2 days.
Okay, got it.
Okay. Yeah.
What are the symptoms for menopause? Can you share again? When in 30s? I think we had the slide somewhere.
Menopause in the okay. No, like I said, one is you have extreme dryness around the vagina. You have a loss of libido. You don't feel like having sex. You feel like you have skin changes. You have body aches. You have very slow during your period. Like it might not even stay for half a day or one day. And the period blood, the way the flow of the blood also is very less. And in the evenings, you might face hot flashes. So this all happens because of the lack of hormones. So these will generally tell you. It's not very common, but it is more than what we saw probably 10 years back.
Contraceptive pills are safe or not? Is there any other contraceptive method other than copper T and pills?
Like I said, there's some implant where it's a small implant that they can put inside. There's something called as a Nuva vaginal ring, which you can apply vaginally and it will go and sit around the cervix. So that also helps. So these are the things other than your OCPs and your IUDs that you can use. There are injections also, but all these will not let you have a normal kind of flow. They will have your flow a little more decreased than normal.
I use a menstrual cup. Will an IUD implant make it difficult to use the cup?
Not really. See, if we cut the thread short, I don't think there should be any problem. Only if the thread is long and you're trying to put the cup and you pull it along with it, then that becomes a problem.
Is menstrual cup safe to use? You can share your thoughts on that.
Yes. See, it depends. As long as you're comfortable, as long as you don't have pain, as long as you use the right size, you know how to sterilize it properly, then you use it. Don't be an ignorant person who just thinks that you wash it with soap and put it inside. You're introducing all kinds of infections inside, and that can lead to problems later on. So, only if you really are going to invest yourself in using the cup, use it.
Yeah. My period discharge is for 3 days and I change pad once a day. Is that?
That is less. So, it would be better that you get a scan and blood test done, because one pad bleeding is something which is very less.
Is abnormal heart beating after 3 to 4 years of cancer treatment okay? What are the chances of getting heart diseases after radiotherapy? You have.
See, radiotherapy as such doesn't cause any problem in the way your heart functions, but due to the stress of the cancer treatment and due to the stress generally, there can be a load on the heart, and you could have changes depending on your even your hormones, which obviously fall due to the treatment, and your age related. So it's always better to get a yearly cardiology evaluation, and they should be able to help you.
Okay. Is it good or bad that getting periods in 20-day cycle?
2021 is okay, it's fine. So it depends from person to person. So if it becomes 18 or 15 days, then you should be worried and they should get in touch with their doctor. But 20 is fine.
Okay. We will take the last question. Sometimes I get heavy flow with clotting that I change pad 8 times a day. What would be the reason? Was it like stress?
Not stress. Stress can cause a delay in period also. But if you have clotting, you're changing 8 pads a day, then you should get at least a basic ultrasound test done to rule out why you're having this problem, because 8 pads a day is not normal.
Okay. I think we are at the end of the session, and I hope everything is answered. Most of the questions we had taken up, and thank you so much, Dr. Deepa, for giving us this session, very informative session. We are here with you again since we had a great time last time. And thank you so much for all the information. Thank you so much for answering the question, and thank you everybody for joining the session. And I hope you had a great session today.
Thank you for having me, and I hope all of you will take it more seriously. And next time, probably the poll has a reverse in the order, because if you all are not happy and you all are not healthy, then your families won't be. So take care of yourselves first.
Yes. Thank you so much. Thank you, everybody.
Thank you. Bye bye.
Thank you.